My name is Andrea Diaz and I'll be going over the external anatomy of the sheep heart. First, the epicardium is the middle layer in between the parietal and myocardium. So that would be this layer here. If you look inside, this denser red tissue is the myocardium. So the middle layer epicardium would be the layer right before that. This is the apex of the heart. This is the right and left atrium. The blood in the right atrium is deoxygenated, and the blood in the left atrium is oxygenated. The right and left auricles are used to transfer blood into the ventricles. This is the right ventricle over here and the left ventricle here. This is the interventricular sulcus, which divides the half or marks the separation between the two ventricles. This contains the branch of the right coronary artery and the left coronary artery. This is a pulmonary trunk. Right in here. The blood from this vessel is going to the lungs and is deoxygenated blood. This is the aorta. The blood from this vessel is going towards the abdomen with oxygenated blood to distribute to all parts of the body. The aortic arch is consistent of the brachiocephalic artery, the left common carotid, and the left subclavian, which are not pictured here. Okay, the superior vena cava would be above the right atrium in this area. The inferior vena cava would be at the bottom, below the heart. The coronary sinus is posterior, and it would be in this region here. It's not able to be visualized. But the blood from these three vessels are going to the right atrium. These vessels are veins that carry deoxygenated blood. Now moving to the internal anatomy of the sheep heart. You can see the pectinate, which is the inner wall of the right atrium. Would be this here. The myocardium of the right and left ventricle would be, this is the right ventricle, and the left, oh, excuse me, actually this is the right ventricle, and this is the left. The myocardium of the left ventricle is thicker because it needs to pump blood to the rest of the body, whereas the right ventricle only needs to pump blood to the lungs. So you can see it's about 3 times thicker than the other. The trabeculae carneae is the inner surface of the ventricle, so it's way inside here. The interventricular septum in here. There are several valves that go from the atrium to the ventricles, and from right to left and left to right. There's a bicuspid or mitral valve, which is goes from the left atria to the left ventricle. Tricuspid valve, which goes from the right atria to the right ventricle. Then there is the pulmonary semilunar valve, which goes to the left ventricle. And the aortic semilunar valve, which moves up to the aorta. The chordae tendineae are like these little hairs. They look like little hairs. Right in there, you see these. And the papillary muscle is the smooth area that you see in here.